My name's Pauline. I'm a stoma clinical nurse specialist at Aintree Trust in Liverpool. I look after patients pre-surgery with education and counselling whilst they're an inpatient undergoing the surgery, and once they're discharged I look after them in the community and clinic follow-up. Ostomists are unique. They're not patients, they're somebody who's living with a stoma. They may not have regular contact with a nurse. They don't want to bother somebody who they perceive as very busy. So they will phone Bullens. They actually get to speak to the same people all the time. The same people who recognise them, who they don't have to explain their situation from start to finish. As a healthcare professional, having a close relationship with the territory managers is extremely important. I know that I can phone, carry up, text her if there's an issue, a problem, and it gets dealt with there and then. Also, I know I do have some clients who will leave things till the last minute and will phone up at 4 o'clock on a Friday afternoon with an issue. I feel comfortable enough that I can phone Kerry up, I can phone the office up, and something will be done, which to a patient who's, for example, looking at a bank holiday weekend with a few bags for to put prescription or anything like that means the world. And if it means the world to patients, then it means the world to the professional service as well, because our service is only as good as the patients believe it is, and it's only as good as the relationship you've got with Bullens. In a lot of areas now, the onus is on the patient to ensure that prescription, the repeat prescription, is being received by the delivery companies. With Bullens, which is slightly different, they will actually phone the client up to say, you know, you're due an order, do you need anything? They also, if the client has enough of one product and not enough of the other, the Bullens is responsible enough and personal enough, they will just actually send out the products that are needed, which sits well with CCGs and meds management in the community, because it's responsible. It's important for us as healthcare professionals to hear that feedback, so that we know that we're giving the patients, the clients, the highest standard of care from our perspective. We have confidence that what we prescribe is getting to the clients in the correct quantities. I feel very reassured that if I ask Bullens to do something, it gets done. And I see that with, you know, happy clients who choose to stay with Bullens, you know, for years, don't move. That's obviously something, you know, something right. And again, from a professional point of view, I've got to have the confidence in, you know, whoever I refer to, that they are going to get the job done professionally, quickly and accurately.